In a bustling city hospital, a curious medical student, Emma, is shadowing the seasoned cardiologist, Dr. Davis. Charlotte, a patient with recent episodes of palpitations and syncope, walks into the consultation room. This is where our story begins, in the intersection of knowledge, curiosity, and necessity. Dr. Davis, a man of experience and wisdom, greets both Emma and Charlotte with a warm, reassuring smile. He turns to Charlotte, acknowledging her discomfort. "Charlotte, I understand you've been experiencing some unsettling symptoms." His words hang in the air, a testament to his empathy. He then addresses Emma, the eager student. "Emma, Charlotte's symptoms may indicate a potential abnormal rhythm in her heart, which could necessitate an ambulatory ECG test." His voice, steady and calm, instills confidence. As the room absorbs his words, Dr. Davis concludes the introductory phase. "Charlotte, your symptoms may require an outpatient ECG test. Let me explain how it works." Dr. Davis, with his wealth of knowledge and experience, begins to explain the indications for outpatient ECG testing. Outpatient ECG testing, he starts, is not a one-size-fits-all procedure. It's recommended for a variety of symptoms and conditions. He proceeds to explain that palpitations, a sensation of a racing or irregular heartbeat, are a common reason for outpatient testing. It's a feeling that may make you feel uneasy, but it is a significant symptom that can indicate an underlying heart condition, he elucidates. The conversation then shifts to syncope, a fancy term for fainting, as another indication for ECG testing. When a patient experiences unexplained fainting, it's crucial to rule out cardiac causes. This is where ambulatory ECG comes in, Dr. Davis explains. At this point, Emma, the medical student, interjects with a question. "And what about arrhythmia surveillance, Dr. Davis?" With a nod of approval at her inquiry, Dr. Davis explains, "Yes indeed, Emma. Arrhythmia surveillance is essential in patients with documented or potentially abnormal rhythms. It helps us monitor the heart's rhythm over a period of time and detect any irregularities that might not show up during a regular ECG test." Charlotte, the patient, then shares her experience with the symptoms. "I've been having these weird feelings in my chest, almost like my heart is skipping a beat. It's quite unnerving." Dr. Davis reassures her, "That's exactly why you're here, Charlotte. We need to monitor these symptoms over time and capture these episodes when they occur. This is where outpatient ECG testing becomes crucial." Dr. Davis then shifts the focus to non-sustained arrhythmias. These are brief episodes of abnormal rhythms that stop on their own. They might seem harmless, but they can lead to serious conditions if not monitored. Hence, the need for prophylactic intervention. As Dr. Davis concludes, he says, "There are different technologies available to us for outpatient ECG testing. Let's delve into them." Dr. Davis starts to explain the different technologies available for outpatient ECG testing. First up, he talks about the Holter monitor, a battery-operated device that continuously records up to 3 leads for anywhere from 24 to 48 hours. Charlotte, hearing this, learns that she can record her symptoms on a Holter clock to correlate with ECG findings, giving her some peace of mind. Next, Dr. Davis introduces the continuous loop recorder, a device that can be worn all the time and records data before and after patient activation for symptomatic episodes. Emma, the medical student, pipes up here, asking about the diagnostic yield of this device. Dr. Davis nods, stating that it's somewhere between 66 and 83%, usually worn for 2 weeks. Then we move on to external and implantable devices. Dr. Davis explains that external devices can be downloaded trans-telephonically, a new term that Emma quickly jots down. On the other hand, the implantable loop recorder, or ILR for short, cannot be downloaded in this way, but is left in place for 14 to 18 months. Charlotte, listening intently, expresses her concerns about having a device implanted. Dr. Davis reassures her, explaining that the choice of device will depend on her specific symptoms and lifestyle. And that's how we monitor heart rhythms outside of the hospital setting. But remember, everyone's case is unique, and it's important to consult with a professional provider. Dr. Davis concludes the consultation with a summary. He reiterates the reasons for outpatient ECG testing: palpitations, syncope, antiarrhythmic drug monitoring, and arrhythmia surveillance. He emphasizes the range of technologies available, like the Holter monitor, continuous loop recorder, and both external and implantable devices. He underscores the importance of personalized medical consultation. Dr. Davis ends with a reassuring statement. "Don't worry, Charlotte, we'll find the best solution for you. And Emma, always remember that patient care comes first."